Hi, good afternoon. I'm Adel Agili, VR consultant at Kekish, and today my talk is going to be about the role of technology and artificial intelligence in ophthalmology. We as ophthalmologists are lucky to have the chance of giving patients vision to live a better life. But the limitations with the number of qualified eye care givers and the potential to affect the community, because 8 of 10 blindness is actually preventable, makes it a very challenging and interesting task in the same time. Looking at the technological side of things, there are three interfaces. We think of patient-clinician interaction as one interaction that's very important. And from the point of view of digital transformation, this interaction can be dealt with in a much efficient way. So we could shift to a more customer-oriented business solution and build a system where there's a very clear pathway since the first interaction of the patient with the doctor, knowing about the clinic, and then scheduling the appointment through online tools, and then working even to the end of the post-treatment stage where actually you can arrange for the patients a ride home, because most of our patients are actually being dilated. This, as I said, will lead to a lot of increased efficiency and cost reduction. There's also technology-patient interaction, which are these tools that we typically use in applications, checking patients' vision, and sometimes answering it. And there are technology-clinician interactions, which is where a lot of the attention and the work is going. And I'm going to talk about specifically here telemedicine. Telemedicine was defined by the WHO as the ability to diagnose and treat patients remotely via telecommunication technology as an essential service for clinical services and decision support. And telemedicine in ophthalmology has a very special and very important role, because we as ophthalmologists are able to make clinical decisions on structured examination metrics and images, meaning that we look at refraction, IOL calculations, OCT measurements, and base our diagnosis on them. We also have most of our data in a digitalized form, which is very helpful in any transformation, digital transformation. When we talk about telemedicine, we always remember this image because it has been something that we see in all of the media and affects how we look at accessing care. Because this patient probably lives in a very rural area in Africa, and through this smartphone technology, he was able to access the care. But I would suggest that you look at it differently, because access of care is not just reaching out to people who are not getting the care needed, but it's also within the time that the care is needed. So this is an example of a digital device, the Apple Watch, and I have no financial interest in that, but where the feature of transferring data through the watch helped in saving this person. This was a very famous story, and I would like to emphasize that this can be used in another setting where you have a very clear triage criteria that's worked through different data sets, where you don't need to keep a patient with CRAO waiting in the waiting area before you can intervene, because we know that this is a very valuable time that he's wasting waiting for us. Another important technology is blockchain. So we think of blockchain in terms of Bitcoins and the crisis that happened in terms of the rise and fall of cryptocurrency. But I would encourage you to look at blockchain in terms of it being in reality, a technology that will soon be instrumental in keeping the electronic records accurate and safe. Because actually, blockchain is a digital ledger or computerized data of transaction, where you actually can share the data between multiple parties to authenticate them. And healthcare and pharmaceutical industries are actually investing a lot in this technology. Also, I would like to remind you of 3D printing, which is something that gained traction recently when there was talk about home building using 3D. But think about it in terms of how we can improve our patients' lives, especially when we talk about the technology in creating an artificial eye, where you actually have a very high number of 3D printing process, where you actually you don't have to wait a lot to have your prosthesis ready. This is also can be useful in the setting of orbital tumors, how you can approach it. And in some universities, such as the University of Columbia in New York, they actually provide most staff with a 3D printer to work on different models, either in terms of, as I mentioned earlier, looking at the orbit, or even in designing different kind of instrument that can be used in the OR. Another important factor which people love, and especially given the ways that this technology is used, is virtual reality and artificial reality. And we know this as a very important training tool, which is something that we have here in KKISH in our wet lab. But thinking about it in a different way, it's also the way we are doing 3D surgery these days. But taking it a step forward is actually implementing it virtual reality, basically in operation. And this is something that has been done in a small setting. It also, as AR, can be used in augmenting the reality of patients, where you actually can utilize the remaining visual field in actually improving the patient's experience. I actually made this presentation a while back. This was before we had the COVID crisis. And we think, unfortunately, we think about the changes that happened in terms of the financial and the health of our patients and the lives lost. But this actually had different impact on digital transformation and on telemedicine as well, because it has helped ease some of the restrictions that were there, push some people to adopt whom actually were resistant for the technology. And there have been a lot of uses in this field. And I would like to share with you some of those that have been shared with others, but in our experience in KKISH, we have utilized this crisis in getting and pushing forward our telemedicine program. So we started using a teleconsultation with physicians in other institutions. Our current telescreening for ROP patients has thrived during this period because of the limitation in moving in and outside in ICUs. We've worked on virtual visits. This was very useful in our oculoplastics patients, because we could do a lot with the images that we gain from them. Also, virtual triaging was very important in some of the cases where you want to make sure that patients are doing well before you push them back in the schedule and working on social distancing. And in the current 2 weeks that I'm talking to you, we actually have our smart clinics, which is something that is modified to adapt for retina patients, where they actually come get their images, fundus photos, OCTs, and then have a virtual visit with the physician. And this is like a hybrid. We have a telemedicine versus a virtual clinic, and it has been working very well. We also think about it in terms of visual medical education, where virtual medical education, when you think about meetings that has been taking place, And in this stage, I want to focus your attention to AI, artificial intelligence. Artificial intelligence has been a very critical part of the involvement or improvement in, in, transformation or digital transformation, because AI is the epitome of all uh, all medical innovation. This has been a very important factor in a lot of the healthcare sector. And thinking about it in terms of its uses, we always remember this model of this droid that walks inside the hospital and helps the nurse provide some of the basic function. But thinking about other models of AI like chatbots, where actually you can use it in customer service, but you can also use it as a diagnostic tool and also as a therapist in some instance. We think of AI as a part of precision medicine, where we actually can actually make a specific treatment to a certain patient based on the data, his specific data. And this will go a long way when we're talking about personalized medicine. In terms of AI uses in ophthalmology, there are many uses these days, but the focus has always been on AI in DR detection. This has been done in many formats, and basically there are some FDA approved forms, and this has been evolving very rapidly in the recent years. There's also other models like the Google models, a DeepMind model. There has been use other than diabetic retinopathy in diabetic macular edema, looking at OCTs. Same goes for AMD, MACTEL, and there's also some trials with ROP patients, which can be also very promising. Not in terms of replacing physicians, but in terms of helping them sorting things out and just focusing on the important cases. There's been also uses in glaucoma, where we actually know that there's a way to detect the progression of a certain disc, looking at it and comparing it for other discs that has progressed in glaucoma through the years. There are also some forecasting measures to help give the exact target IOP. There have been uses in anterior segment as well, with keratoconus, dry eye, refractive errors, predicting the best results in the surgery, especially after a refractive surgery. Also, it's used in as well in detecting corneal ectasia after LASIK. There are also some very interesting fields of discovery, such as the new publication that we heard about how retinal images can be a biomarker for different kind of diseases, such as Alzheimer's, Parkinson's, renal diseases, cardiovascular diseases. These are all very interesting and very important advances. The challenges in AI are very known as well, where we know about the issue of the black box, not knowing all the details of how an AI is reaching its results has been very challenging, because we as scientists work through the scientific method where you have to reproduce the way you reach those results. And this is something that can be challenging with AI. We go also to the issue of what kind of data you feed into an AI, because you could show an AI that actually seems effective, but once you start feeding it bad data, you'll get bad results. Issues with privacy are very important. I'm showing you here an image of a ring that's made of from a picture of the fundus. And this has actually been something that's been advocated in terms of ways for detection, such as what you have with a fingerprint or an iris scan. There's also the ethical issues of how would we proceed in life, not knowing a lot of the details that the AI know. and a very important factor is the public trust. And I would like to finish by this part. We at Kekish have been trying to work with different research institutes and entities to also achieve something of that, because there's a very important factor with regards to what we can achieve um, using our own data that can be unique to our population and of more benefit. And this is something that we've worked with our friends in Taiba Valley, in Taiba University. And we have reached with them a big advance in this field, where we actually have a current model that can be deployed in looking at images and giving a good predictions. And the progress has been very interesting and um, very delightful. We have reached almost a sensitivity of 95% and the specificity around 84%, which is a um, very good model, to be honest, at this stage. We've also partnered with other entities such as Lean Company, Kmark, and also the King Fahd Petroleum and Mineral University. And with this, I would like to thank the organizer for giving me this position, and thank you all for attending.